Hi, I'm Dr. Power from Power MD. We're a med spa located in Marin County, just north of San Francisco. So I'm here with a patient today. We're going to demonstrate the volumetric structural repair rejuvenation technique. I call it the V-lift because we're going to really make a nice oval shape and correct some volume loss to give her a soft, feminine, young look. She is already very young but thin, so we do have a little bit of fat loss here already. So the V-lift is really based on what is anatomically occurring as the face ages. So it is based on the anatomic structure of the face, what we know now about the aging process. So there are several deep fat pads in the face, and those deep fat pads atrophy as the years go by. And especially if you're thin like you are, and when you lose that deep structure, then the face can kind of move downward. So what you're going to see in somebody who's really young like this, when you lose some of this structure in these fat pads, is you start to see a drop of the cheek. These superficial fat pads will drift down. You'll get this shadow. And this shadow here will be revealed because of this drift downward. You also can lose that nice round oval shape. You don't want too much fullness here. And down here, you want it to be widest and fullest right up here. So to do this treatment, we're going to use Voluma. Voluma has a great, nice lift quality to it, but it remains nice and soft. This is hyaluronic acid, so it's a natural product, and it will naturally break down, but Voluma is a very long-lasting product. I've numbed the skin and cleaned it, and we are ready to go. Now, you've never had filler before, right?
Mm-mm.
So a little nervous?
Yeah.
So we're going to start sort of laterally and sort of pop out these cheekbones so that they stay nice and high. I'm also going to pull up a little so that she gets a little bit of extra support behind some of these fascial pads that really help lift all of the skin. How was that?
Interesting.
All right, another one right here. Bear with me. All right, are you doing okay?
Mm-hmm.
And you just let me know if you need a break at any point. I love these cheekbones. And turn towards the camera a little. Okay, so now we have nice high cheekbones with a little bit of this product. Then the next step will be to fill in here in the mid cheek to lift up this fold and to lift up there and to sort of pull forward and sort of soften the shadow underneath the eye there. You doing okay?
Mm-hmm.
It's your first time with fillers. Ready? Little pinch. So already here you can see a little bit of lift and a little effacement of some of these lines. Now we do like to go in and just pop this out a tiny bit. We have to be careful in this area because there are some vessels that we need to avoid. Sorry. You're doing great. Catch a little bit more on the cheek here. Take a look straight at me. Good. So we can see here this roundness of the cheek right up here. where it's a little bit flatter on this side. Don't know how easy that is to see with the video. We'll go ahead and pause and get some photos of this. So there's a little bit of a hollow at the outside corner of the eye. So we're going to go in and just put a tiny bit of product here to pop this out. There's another deep fat pad in this area. And loss of that fat pad also contributes to some of the visual facial aging. So you can go ahead and take a look at that. I know it's a little uncomfortable, but that sort of softens this shadow here. I'm going to get the mid cheek on this side so that we can have lift on both sides here. Sorry. Feel that one, huh? Mm-hmm. So do just a little touch more here to efface this nasolabial fold. What we're really doing though is treating the cause of that fold, which is loss of the deep fat pads and a little bit of downward drift of the skin, the tissue that those deep fat pads were previously supporting. So we're going to finish up on this side here now. We're going to start up on the cheekbone to make sure that your cheekbones are the widest point in your face, because in women you do want the cheekbones to be the widest. That's the top of your V. Now, Voluma will last 2 years. You might not have full correction for 2 years because it is gradually being broken down. It is made from hyaluronic acid, which is a bioidentical product. It's exactly like what your skin contains already. That gives it the nice shape or the nice softness, then helps to support the structure, support the skin. Because your body has an enzyme that will break this down naturally over the course of the next 2 years. A little pinch. Do recommend that every 6 months you come in for a little bit of a touch-up to maintain your beautiful results. Again, lifting up that middle fat pad, and that is going to efface the shadow under the eye and also lift up this nasolabial fold. I'm sorry, this one's a little pinchy. Sometimes people want to sneeze when I inject right here. Okay, let me see. Great. Now I like to see people back at 2 weeks so that we can see if there needs to be any corrections. And then, as I said, every 6 months. Typically putting in about half of what we started with. So here, if we start with 4, we're going to come back in with 2. Just for reference, there are 5 of these syringes in a single teaspoon. So we're using just under a teaspoon of hyaluronic acid to lift her face and give her the nice V shape with nice cheekbones. We don't want to lose those, but with the fat pad in the mid-cheek recovered and replaced, we lose some of the shadows.
Hi, Ashley, how was your treatment?
It was good. It was a little different. It was a weird feeling for the first time, just feeling the filler go in, but it wasn't painful. It was just a little different of a feeling. I think I'll get used to it.
Awesome. Well, let's get you in for a 2-week follow-up so we can make sure all of the results settle after the little bit of swelling you're going to get. So it looks like she's got an appointment on Tuesday at 2 o'clock. Is that right?
Can we do morning?
Yeah,